This is Tony Young. I'm the president of Arise San Diego, and we're really thankful that all of you are here today. A little bit about Rise. We focus on urban leadership here in San Diego. We foster that. We work with the University of San Diego to really kind of bring out true leadership in the urban communities and for the urban communities. We also provide support for nonprofits, and we do trainings every week or every few weeks to provide to our nonprofits in our community. But today we're going to do our third pillar, which is our civic engagement. And the reason why we thought that this is important, we've been doing it every week, is to talk about how the urban community is being impacted by COVID-19, and particularly this issue here in regards to the immigrants and really some of our most vulnerable communities, but also very unique communities that are the backbone in many ways of our economy, as we can see right now. And what does that mean? How are we dealing? The true people who are doing work in the communities right now, trying to address those issues, what are they doing and what are they seeing? And so that's what this is about, and we're really excited for you to be here today. So thank you for that. We want to say thank you to Ian, Graciela, Joseph, and Arwa, who are all panelists today, and Dr. Green, Dr. Zachary Green from the University of San Diego, and the lead faculty member here at Rise is going to be our moderator. So thank you again.
Thank you, and welcome to this COVID-19 community response from Rise San Diego. We would like to alert you to the community guidelines that we follow when we're doing a webinar here. So all of you will be on mute, but you're encouraged to participate. And in a moment, we're going to have you participate. We're going to have you do a poll around the kinds of issues that we see that are at hand right now in terms of immigrants and refugees as it relates to COVID-19. You will also see there's a question and answer box, and you can also use the chat function as well to provide commentary along the way, and we'll try to fold that in. So we want this to be as interactive as possible. This webinar will be recorded, so just be aware of that as well. So at this time, what we'd like you to know is that we want your perspective on what is really at issue here. So here's a poll question for you. Please choose an answer on your Zoom screen for this poll. Here it comes. So the poll is coming. There we go. In terms of your perceptions of the needs of immigrant and refugee communities in San Diego, which of the following do you believe are most important to address? The central role of immigrant workers that they play in the frontline occupations such as healthcare, food production, and transportation, and thus more likely to be exposed to the virus. Workers' rights and labor protection for immigrant workers during the COVID-19 pandemic. Immigrants who are disproportionately suffering from economic hardships caused by the shutdowns. Immigrants in the United States and how they are facing difficulty accessing health care and the issues at detention facilities and the challenges that are being faced in terms of controlling the virus. So please indicate for yourself which of those do you believe is most important to address. And we'll give you about a moment, about a minute rather, to indicate your response. Another 30 seconds, please. If you're just joining us, there's a poll and you can address which one of these issues you believe are most important in terms of refugee and immigrant communities as it relates to COVID-19. Okay, we're going to close the poll now and we'll get our results. Okay, so as we can see, and if you can scroll it down a little bit so I can see the detention facilities one as well. Okay, I see the percentage on it. What we're seeing here is that those of you who are listening, is that the immigrants, in terms of the disproportionality of suffering, the economic hardships caused by the shutdowns and the social distancing, and the exclusion from the CARES Act is really what's on your mind right now. In addition to that, the role that immigrants and refugees play in terms of the role of being on the front line. And what we know from data that we're about to show you is that it's a larger percentage than you might imagine. So what we're going to do right now is we're going to show you the slide with the panelists. And then what I'm going to ask each of the panelists is to give an introduction to what you really see is at issue. So we're going to go in the order that we see here. Graciela, you're going to be first. Say your full name and then what it is that you see at issue right now. Graciela.
Good evening, everyone. My name is Graciela Uriarte. My pronouns she, her, and I'm an organizer with the ACLU of San Diego and Imperial counties. For me, one of the biggest issues that I've seen with regards to the immigrant communities and the impact of COVID-19 are that undocumented families have been left out of the federal relief, the CARES Act. And as a daughter of farm workers, that's an issue that speaks to me in my heart. And I'm happy to speak and elaborate further when we get on with the webinar.
So I just want to start where you're coming from. So this isn't just something that you're looking at from your role in the ACLU. This is something that you actually think about and know about from your own history and family. Am I hearing that correctly?
That is right.
Okay, thank you. Ian, say your full name and give us some idea of where you're coming from in terms of this issue. Open your mute. There you go. Thank you, Ian.
Hello, everyone. My name is Ian Seruelo. I'm an immigration attorney. And my biggest issue here is that, people of color are disproportionately suffering, and dying, from COVID-19 because of this administration's, policies and willful inaction on this crisis.
So what you're talking about is not just the impact that's disproportionate, but you're also saying that there are policy implications in terms of the government response that are adding to this circumstance?
Correct. Especially as an immigration attorney, later on, we will talk about how this crisis is being used to even push the anti-immigrant policies of this administration that has really bad implications when it comes to immigration.
Okay, thank you very much for that introduction, Ian. And then Joseph, say your full name and tell us where you are really seeing this crisis hit us.
So my name is Joseph. My last name, they pronounce it Ekyoci. I'm a founder of Kupanda. So in my community, the issue that I see is education support. So I feel that the education system is not being supportive to many refugees in our community, especially during this time. A lot of people who just been here for short amount of time, they haven't stayed here for a very long time. They are facing very difficult issues when they come out to communicate with the administration for school.
So what you're saying is that even though there are education efforts, those education efforts, because of a variety of barriers, are not really touching the community the way that you would like to see. Am I hearing you also correctly?
Yes, correct.
Okay.
That's how it is.
That's how it is. Okay, and Arwa, so please say your full name and then where are you seeing COVID-19 affecting the communities where you're an advocate?
Hi, everyone. My name is Arwa Alkhawaja. I work with the local mosques, like here's like my background, like to help, to provide help for the immigrants and the refugees. And one of the biggest problems I'm seeing is not only the lack of, like, I would say only financial like support and resources for these immigrants and refugees, but also the language barrier. It is a huge obstacle for them to reach out, like to the needed even help, or even file for the help that they need, or to go and ask, how can I apply, like we say, for money, for help, for food stamps, and so on. So it's the language barrier. That's the biggest challenge that I'm seeing now.
So if I'm hearing from the panel, what we have is that not only are we having disproportionate health outcomes, the policies of the government are leaving in vast populations of immigrant and refugees from our communities out of the equation. That these policies are having dramatic impact because of language barriers, because the education is not getting there, and that what we are really beginning to see is that this is actually creating more of an issue than we've had before. Am I hearing the panel correctly? Okay.
That is correct.
Yep.
Yes, actually, when the whole problem started, like a lot of refugees, they did not take the issue serious as they should, because they simply did not understand how serious that is because of the language.
Okay. And Ian, that's your view as well from your perspective as a lawyer?
Yes, correct. I 100% agree, especially even when it comes to workers. For example, I also do employment law. So the impact to workers is also really harsher because of that language issue. Like even accessing unemployment insurance, and all the forms are in English. So it's so we have, you know, to have community and the union help these people to enable this our brothers and sisters to be able to access this insurance benefits. So
Okay.
it's really harder for, you know, the language is really a big issue as well.
So I want to work with where you just started, Ian, and if we can pull up the slide on immigration and COVID-19, and let's just add some data to this picture. So if we look at this, and we know it's a little bit hard to see, but what is really most important in terms of COVID-19 is that upwards to 25% of the people who are on the front lines as home care workers, as physicians, as pharmacists, as home aid, as surgeons, as lab technicians are from refugee and immigrant populations, which means that not only are we finding that immigrant and refugee populations are present and really providing a service for people who may be strongly and adversely affected by this pandemic, then we have that based on what the panel is already saying, that there's an impact in terms of the lack of access and the disproportionate outcomes for these communities. So this is where I want to go to Graciela again. Graciela, we also know that there are things that are happening in terms of detention and things of that sort that you're trying to work with from the ACLU. Am I understanding that correctly?
Correct.
We can't hear you, Graciela. Okay,
That
thank
is
you.
correct, Dr. Green.
Okay, can you speak to some of the things that you're saying?
Sure. So I'm not first and foremost an attorney with the ACLU. As I said earlier, I'm an organizer, but I came to speak to the civic engagement that we as people, citizens or non-citizens of this country, can advocate on behalf of folks who are currently detained. So I would just like to offer also some updates on, I'm not sure if everyone here has heard, but yesterday we had reports that the first case of someone dying at Otay Detention Center. And I would just like to offer a moment of silence for this individual and their family. And yeah, just moment of silence. So at the organization, thank you all so much. But also on a personal level, what we've seen is that mostly folks who have been detained right now, who are medically vulnerable, are susceptible to catching COVID-19. In Otay Mesa right now, there are up to 200 cases of people who have tested positive. And so we have, the organization lawyers have filed a lawsuit on behalf of plaintiffs to make sure that people are released, those who are most medically vulnerable. So I think that right now, those are the people that we need to be advocating on behalf of.
So let me follow that up a little bit. What we're talking about is that the people that are in detention are disproportionately likely to be exposed to the virus because of the circumstance.
Can I interject, Dr.
Please
Green?
do, Ian. Yes.
Okay. So, I represent detainees who, individuals who are detained at the Otay Mesa Detention Center.
Yes.
And, I have been advocating for the release, especially in light of the increasing infections in the facility. So as Graciela noted, right now there's more than 200, but if you see the pattern, really, it's really scary. Like, 2 weeks ago, it was just 42, and then suddenly the other date's 132. So it tripled. The cases tripled in just 2 weeks. So and then we had that fatality yesterday, which is really sad, but it's not surprising with the policies of ICE. They are dragging their feet, despite of the order of Judge Sabrao, on the case of the ACLU, where the judge ordered the release of those who are over 60 years old and those who have a medical condition. Yet again, ICE and Core Civic is dragging their feet and releasing those individuals. So, and the situation in the detention center is just really bad, with the issue about access to masks, issue about access to nutrition, the disinfection of the facility, and the fact that they are not even able to do social distancing in that facility. The space is so small, and it's impossible. My clients was telling me there's 2 of them in one cell, and they can't even practice social distancing. So it's really that really puts them in a very dangerous situation. And not only those with medical condition. In fact, everyone is affected in that detention facility.
So we have a photograph that we've brought up that shows the conditions that are happening not only here, but across the world in detention centers. And so the protocol around having some kind of physical distance is not even possible. And so therefore, it's no surprise that the infection rates are tripling over the last couple of weeks. But Joseph and Arwa, we know that in your respective communities, there are also issues around education and language that you've referenced. So Arwa, can you speak more to that first? And Joseph, then I will ask you to follow up with that as well.
For the language issue, it's like I know there are some refugees, and they are in detention facilities, and some of them are not in the detention facilities. So, but they are needing help. We have some organizations who are reaching out to those families. Those families have no idea on how to file for help, even for any kind of help, financial help, how to even if any document paper, they do not know how to do that to a file. Add to that, there are some, I would say, immigrant families with low income. Their children now have stayed at home, and then the parents now have to provide the homeschooling for their own children. So let alone is the finances, they don't have the internet itself. And once, even if the internet is available over there, parents do not know how to help their children with schools, especially elementary children, elementary school kids. So it's just like children are staying at home, not knowing what to do. And a lot of these families are large families, honestly. They have a lot of members in the same household. And then, so you could, I want to add, like, in addition to the language barrier, it adds a lot of like stress to the family, and honestly, like a lot of domestic violence is happening as a result. It's like parents are not knowing what to do, they cannot help their children, children are demanding, and so it's like it's a chaos. This is like something we are seeing amongst the families. Some of these, there are some undocumented like immigrants. Some of them are even scared to seek for help because you know what might happen to them. And then you know how serious that is. If there is someone who's already infected with the coronavirus, like it could be carried on to someone else and they do not know what to do, and the dilemma just continues.
So you're speaking to a lot of the dilemma, and I want to hear from Joseph, but I want to come back to some of the things that you're saying, Arwa, because there are other perspectives on this that I really want to fold in. They don't reflect my own views, but I think we need to talk about it because of the complexity of this issue. But Joseph, what are you seeing in your community, please?
So, yeah, so like she said, so in my community, there is a lot of issue, especially through education. So I work with the Kupanda as a tutor. So, and some challenge that we face is when we are supporting this case, like online tutoring, there is a challenge when they come up to the housing. So you will see one family, so they all are home and they live like 10 kids or like 11 kids or 12 kids at like in a house where it's 3 bedroom. So, and they all have to use internet. So that is a very big issue to them, especially when they come up to jump online at once. They all needed the support that is being provided in the community. So that's a big issue because when they come up to supporting them, it's a difficult because you have to work with like one person have to work with 3 people or 4 people, and both they are living in the same house. There are a lot of noise, so you cannot really help them. So another thing that I would like to share is their parents too, they are struggling to do application of unemployment benefit. Some of the parents haven't filed them, and some of them they already filed it. We've been working together to try to help them out to file an employment benefit. Even though like they have passed the law for social distance, we are trying our best to be online and to try to help them out.
Okay, but this is what I have to raise, Joseph and Arwa. There are some voices, and again, this doesn't reflect my view, but it's a view that I need to bring in here, is that it is because the communities are so insular and so focused on your own culture that it's no wonder that these things are kind of happening. But yet we have people who are listening right now who are saying, then how can we help? How can we provide the education? How can we work with the Otay Mesa facility? So, but first for the two of you, how do we respond to voices like that that seem to want to blame you for the circumstance that you're in?
So I want to share that part. So I see there is a solution among that, and I believe the community, we should work all together in order to combat it. This is a very challenging time, and we should also know that like there is a lot of nonprofit that are doing good work, working with this vulnerable community who don't really have access to a lot of benefit. So I think we should be able to like getting ourselves there and try to support out. So Kupanda, we hear all the time. If some people here want to be share the website, I can pretty much share them. We want tutors who can be able to support the kids so they can also get the support they need so they don't fail the semesters.
Okay, so what you're saying that there are nonprofit organizations and advocacy groups that are functioning right now and they just need support. They need to be connected. Am I hearing you correctly?
Yes, correct.
Okay, and then Arwa, what do you have to say about some of these critiques that we're getting from the community, about the community rather? Thank you for smiling
okay.
about it.
Well, I know sometimes, honestly, I don't know. This is okay. A critique I respect. Sometimes, like we want to help, and then we do not know how to help, and sometimes we want to extend a hand, and then we see like the hand is coming back empty. Like there are cases like that are happening, but if, for example, speaking like someone who's Muslim also, like when we want to help, we don't only say we are helping the Muslim community. There's a lot of organizations in our societies that there's like carries numbers, and people are there with all different faiths and races and religions and backgrounds and so on. And then when we offer the help, we offer it to anyone who needs it. And it's for the public. And we want to work, and we said many times, we want to work with all these possible like organizations, and then we're welcoming all of that help to work with others. Now, we're not, as organizations, trust me, we're not focusing only, for example, I'm a Muslim, I'm going to say I'm only going to help a Muslim immigrant or a refugee or something like that. That doesn't make sense. That means I'm very selfish. I'm not helping. I'm just not doing the job right. So when you go to, for example, detention facilities, you just offer the help to whomever over there who needs the help. And then you just, like, there's the data in the cities, you can just get the information and see who needs help, and then just give the help and extend the help to everyone. So you give the help and you accept the help from anyone who is knocking on your door. But you just, like, people also have to, like, say, to take the extra mile or the extra step. Let's see, like, there are so many organizations. That's something we all have to, I believe, work on, is to be aware more of these nonprofit or these organizations are willing to help. And then, like, I would say sometimes it helps, like, the word of mouth. It's like, I will know, oh, this organization is helping. Oh, I'm just happening to know there's a new one now who's helping. Like, today, I honestly found out there is a new organization. It's called, like, here, I wrote it down, Borders Land for Equity. This is a new organization that is willing to help anyone who's been, like, subject to kind of discrimination, be it for race, for color, for all of that. And they're providing help for the youth, college youth, like college students, for everyone, including Muslims. But this nonprofit organization is founded by Muslims. Okay. So we want to work with everyone.
Yes.
Like where the hand is there on the camera.
And so what I also want you to know is that the hand is also there in the chat, because what we have here is the County of San Diego would like to figure out how to bridge in terms of the public health nurses and community health action teams so that they can work more with the refugee and immigrant communities. So let's see if we can actually make that happen, because that's already being offered in the chat. So, but I want to turn now to Graciela and Ian again. So there are some policy implications that you're both wanting to talk about. And so I'm going to let you, Graciela, there are things that you really want to speak to that you're seeing in terms of policy that really need to be addressed. So Graciela, you get a couple minutes here, go.
Yeah, I'll allow for, Ian, I think you were going to speak to the CARES Act, so please go ahead. I am not an expert on that issue, but I do want to speak to my lived experience again, as an advocator, someone who advocates for and with folks who are in the farm worker community.
Yes,
both
please
in the
stay with
Central
that,
Valley.
because that's part of what I want to hear, because there are policy implications, because all of a sudden farm workers are essential workers in this crisis. But yet they
all of a sudden, that is right, all of a sudden. So
have the same rights. So
correct. So all of a sudden, farm workers are essential workers, right? And we're seeing that people are, the food chain has not been disrupted. People are still able to go to grocery stores and get their produce. But who's putting themselves at risk in order to do that? It's the farm worker community. My parents, my mom texted me last night saying that she just got a call to go to work in El Asadón, which is to work really long, hard hours with a hoe to prepare the fields to make sure that they're ready for the crops that are going to come in the summer. And in terms of protective gear, farm workers don't have access to that. So a couple of weeks ago, in coalition with the Norris County organizations called the Farm Worker Care Coalition, a lot of us throughout the entire county, folks from the South Bay, from Southeast and Central San Diego, and everyone around the county showed up to show support in caravan of cars for farm worker communities in the North County region, so Carlsbad, Vista, and Oceanside. Of up to $16,000 was raised for farm worker communities, so that people who are undocumented and families who are undocumented who are left out of the federal relief funds were, able to are able to tap into those funds with the Farm Worker Care Coalition. So in terms of that end, I just want to say thank you so much for allowing us to speak on the experiences that we have and our personal, attachment to these issues. As for me, I'm going to continue to be vigilant to what's going on in the news and any policies that will be passed, but I'll hand it over to Ian so that he could speak to the CARES Act.
Right. Thank you very much for that, because what you continue to speak to, Graciela, is that there's a personal aspect of this. This isn't simply from an ACLU official position, but it really is something that is in your family. And it really speaks to the legacy of the farm workers stepping up in these kinds of circumstances to make sure that all of us are able to do this, but then putting themselves at risk in the process. Now, Ian, the CARES Act and other policy dynamics, you have a lot to say on this, but let's get the essence of it, and then we'll talk back and forth a little bit. You're on mute.
Okay, sorry. So let's, I want to talk about more about the impact, if I could. Like, for example, the policy, one specific policy that we as immigration attorneys face is how this administration is using this pandemic to to discourage immigration, or and not only the policies that were implemented months ago regarding the program called the MPP, or the Migrant Protection Protocols, where like it seems that this administration is just hell-bent on trying to stop immigrants from being able to come to the US, both legally and illegally. Okay, so right now, for example, there was that recent executive order that was released on April 22, where the president stopped the grant of immigrant visas for people to be able to come here to become permanent resident, in the guise of helping workers amidst COVID-19. What they are telling us is that they need to stop the issuance of green cards, because these immigrants, as always, are the reason why the jobs are low, or that we are the ones being blamed when it comes to every time there's an economic issue, every time there's a problem with unemployment, it's always the issue is always it's because of the immigrants. So I think right now that is the reason behind that executive order, which affects many families. Okay, so many families, although they're saying it's only good for 60 days, but it's actually just one of the part of the whole policy of this administration. Aside from that, aside from that executive order, of course, is that the COVID-19 also affected immigrants in many other ways. For example, all the immigration courts are closed right now. So adjudication of all the cases for asylum, all the cases for, everything, all immigration relief are practically stopped. Still USCIS is still open. We're still able to file family petitions, but still the adjudication is very slow, and definitely it has that really bad impact to the immigrant and the migrant families. And I think
can you also educate us about the CARES Act and how immigrant and refugee populations were left out of that, please?
Well, yeah, so that's the problem. Okay, I think that and since we are talking about the issue of health, and especially amidst this virus, immigrants are always the ones who are disproportionately affected. You know, we are most, like for example, here in California, 20% of our foreign nurses here are Filipino nurses. You know, coming from the Philippines, and many even in New York. Okay, especially in New York, like the unsung heroes are the nurses who are just silent behind the scenes. Yes. And the death toll among Filipino nurses in New York is really very high. And many of the families, like both parents are nurses. They you know, so it's a really sad story of this not only Filipinos. In fact, you know, in fact, there are also a lot of Latinos and other nationalities from you know, in the medical profession that has suffered so much. And we hope that the policies that this will shape policy in the future, that the CARES Act and other policies that will support health to the migrant community, not only the, by the way, not only the documented, but also the undocumented, which also is suffering so much. Like for example, here in California, we want the seniors to be included, to be eligible for medical, and that is the Health for All Seniors. There's a pending legislation that we hope will be passed that would cover at least the senior citizens, even without regard to their immigration status, and also the earned income credit, for example. You know, an undocumented, many here in San Diego, as a border city, we have a lot of mixed status families. We have like you know, US citizens with undocumented parents, and or some. We have, you know, U.S. citizen parents and some undocumented children, and many of them, when they file tax returns, and they don't have social security social security number for their children, and they are left out of the earned income tax credit. So there is also a legislation right now that is pending in California that we want to support. And of course, there are others like the health and safety for all workers, where home care workers, again, in the area of home care workers, most of the home care workers are also from people of color, from the immigrant community. Right. And right now, under the current law, they are not covered. You know, they are excluded from some laws. Okay, from protection from some laws, and we want them protected as well.
Yeah, one of the people who wrote in the chat, there's a lawsuit around the CARES Act excluding citizens of children of undocumented immigrants who are actually US citizens. So that's one of the things that we're beginning to see here. And if we can pull up that slide again on the data, because what Ian just alluded to, and one of the people in the chat wants to know is, so where are these data coming from? And so one of the things that we want to point out is that we mentioned this up top. These are national data, but it's also very true of San Diego. If you look at the immigrant populations in terms of occupation and in terms of selected occupations in healthcare, you will see that 25%, upwards to 25% of the nurses, home aid workers, and surgeons and lab technicians, and 25% of all doctors are immigrant and or refugees. So therefore, the exposure to the virus is disproportionately hitting communities that we're a part of. But there was something that was referenced a little bit earlier, and I want to speak to two things at the same time. As quiet as it's been kept, Governor Newsom recently allocated $75 million, and it's very controversial, to help exactly the communities. But I was wondering that do the panelists here even know that that program exists? And I want to start with Arwa and Joseph. Did you even know that this program exists, that there are allocations to help families of refugee and immigrant populations? Joseph, you're on mute.
Can you hear me here?
Yeah, now I can hear you. Thank you.
Okay. So in terms of like the law that being passed, they have like $75 million to support refugees.
Yes,
Um, I don't have enough information about that.
precisely. Okay, and Arwa, were you aware of this
Yeah,
program?
same here. That was good to hear from you.
Right.
Yeah.
Okay, so this is one of the things, is that there is an active effort not to publicize it because of the controversy that it's going to create. But yet the fund does exist, and various nonprofits across the state have been chosen to make this distribution. But this runs into an issue that we already know, that exists. That in terms of education, we know that at schools, in terms of distribution of lunches and distribution of laptops and tablets, that undocumented families or mixed families with an undocumented person have not been going to access those materials, and therefore their children are losing this opportunity for what is going to end up being 3 months of school. Are either of you aware of the impact of this going on in your communities? Have these been the same kind of things that you've heard about? Arwa and Joseph.
For the lunches, my kids go, like, honestly, like, this is what I know about Poway School District.
Right.
And then we received like emails. They first required like for the children to go and receive like the free meals, and then required an ID for the child.
Yes.
And then after that, actually in a short while after that, they said children could come and pick up the food and they do not have to show the ID, and it's like the family could come. So that was honestly amazing. That was great. That opened the door for those families. But when it comes to laptops, I am not sure that they're like the refugees, like, or like children or families who are like undocumented were able or had an access for like the technology for them to use that with their children. I think it was always something behind the doors, or someone donates to them or something like that, but not officially. I'm not aware of something official for those families.
Okay. And what about you, Joseph? Have you heard about this, or are there issues around this?
So in my community, most of the kids that I work with, they had access to laptop. They got it from school, and I'm in the email group from some organizations. So they were able to send me some information to let our community to know if they also give me free food. If the parent want to go to pick it up the food, they can go with the kids to pick it up the food. So I was able to give away that information, and the most some parents they do go to pick up the food, and then a couple places they have a food station in our community. So I specifically live in City Heights.
Now, there's one issue that I really think is important that we talk about, and Arwa, you alluded to it, is that the amount of stress that this pandemic is causing all of us, but how this has even created more stress for certain communities. That there's an increase in child abuse, domestic violence, not just in the communities that we're featuring tonight, but this is larger. And the issue is that there is the trauma collectively of the virus and the pandemic, but there's also the trauma that refugees are often escaping in order to be present, and that these things are coming together. So I would like each of you to just speak to the psychological or the trauma aspect, and what do you believe personally is going on in terms of the impact on families? And so, Graciela, you've already spoken to that, and if you're open to speak to that more, what do you think the impact of trauma is on families of refugees and immigrants in these times?
So thank you for that question. You know, for so many of us who come from countries, resiliency and survival is all we know. So the trauma is going back to what you know and fight or flight, right, or freeze. So what we're seeing is that a lot of our folks in the community are fighting and are showing up. And that's, you know, not necessarily that's not something new. But that gets tiring, and that creates more trauma. And I feel personally angry and convicted to continue to show up and whatever that means, to show up in different ways, whether it be for my family, for my friends, or at work. You know, that's what matters most to me.
Thank you very much. Joseph, the trauma on top of the trauma, what are you seeing?
So personally, I would just say, like, I have one family that I was working on yesterday. Um, the kids, they're about to kick them off in school. They go to Hoover. So that she's a woman, so she's 17 this time. At this moment, she's 17. So since she doesn't do well on the internet, instead to find a solution for her, to give her like a mentor, or to give them like a tutor, somebody who can support her during this time, like they have sent like a couple phone call to the parent, and they are trying to kick her out from school. And I feel so painful because most of these kids, they grow up in refugees, and when they come here with a parent, they have all this big dream and they want to go to school and they want to pursue like higher education. So it is too complicated. It's too complicated, and I don't know how I can explain it.
Okay, but what you are explaining is that here it is a child who's looking for an opportunity, but working with the internet and with the computer is difficult. And so then the school's response is to kick her out, as opposed to embrace her and try to find ways to work with her.
Yes,
and so that adds to the situation.
Yes, correct.
Okay.
And that's a deal. A lot of kids in our community are facing that. Personally, even without even internet, before like even the COVID-19, a lot of children are really, really facing that challenge in school. And they don't even have a way like how we can all work together between like a parent, mentors, teachers, like trying to find a way how we can support these students so they can succeed as well.
Wonderful. Thank you for saying that so powerfully. And Arwa, what are the kinds of things that you're seeing in terms of the trauma on top of trauma?
Well, when you say refugees or immigrants, usually refugees are escaping from harmful situations. So they're coming already with some heavy loads on their chests. So now we used to be able to provide free services or help through the mosques, for example, if you want to talk about the Muslim community, like where marital issues or something like that. And I want to say, it's like it was also, it takes a lot of effort to even for those families to seek help. So once they took the step and they are seeking help. Now we used, as I say, with the mosques, we used to offer that, so it's not there anymore. So it just like all what you hear is like problem is like, honestly, I would say there are some families, I do not know what's going on over there. I do not know if the help or they could speak. So, but you could tell there are issues, sometimes messages, notes here and there, but I don't know, seriously, a lot of families, I'm just concerned, I do not know what's happening in their homes. Especially, I would say, like, maybe as a Muslim, I would say, like, to give an example of our cases, when we are in the month of Ramadan is like where a lot of Muslims used to go to the mosques and socialize with each other. So sometimes it's not like kind of a professional help that you need to provide for the family, but you just need to provide these social interactions. So it's not happening as easy as before. So just like kind of families are trapped with each other, again, to take it on each other. But I would say, it's like, it's so sad, and I'm worried about, like, I know it's like there are some families, I'm just concerned and I don't know what to do. It's just like you just check and then it's like everything is fine. Of course you will always hear the answers, everything is fine. So we're just like trying to provide like as much as we can, like kind of, because it's not always there's phone or something. It's just like kind of, again, it's the word of mouth. If you need help, let us know, we can come to you, but nothing more that we can provide.
Thank you again for speaking to the challenge of this. We're getting to the point in this conversation where there needs to be a call to action, and I'm going to ask each of you to speak to what would be one call to action. And there are some requests that are being made in the chat and in the questions, so I want to speak to those. First of all, panelists, if there are organizations that you know of, what we can do is you can respond in the question and answer directly, if you would like to, around the organizations that you're a part of. But in addition to that, I think we at Rise San Diego will then work with you to identify immigrant and refugee organizations that we really believe are reputable and are serving the community, and make sure that we make the bridge with the county, because the county is literally asking for that bridge. In addition to that, we have in the chat, there are questions about then how do we respond in a way that we as a larger community can support each other. So let's begin to now, each of you in that 1 minute, just speak to one thing. If there's one thing that you want as a call to action, what would that be? And then let's see, Graciela, would you be willing to start that off? Like one action that you believe is important in terms of immigrant and refugee communities.
Thank you. So one action folks could take today, if you have the means, please donate to the Detention Resistance. They are an organization right now, the Otra y Mesa detentionresistance.org. They're fundraising to provide housing for folks who are being released. And you just go to the website, I'll plug it in the chat so that folks know what exactly they're going to be supporting with those funds.
Okay, thank you. Because you're saying that that's a very real and immediate need right now. Yes, okay, thank you. Ian, one call to action.
For me, I'm thinking about the longer term, especially with the impact of this COVID-19. On Monday is Immigrant Day. Usually in previous years, we go to Sacramento and do a lot of advocacy work and knock on the doors of our assembly members and senators. But this time we are not able to do that, but we will continue with, with other partners. We will be doing it online. So we will be pushing for legislation that would impact the immigrant community here in California, especially here in San Diego. So if people could also support this legislation, the Health for All for seniors, the California Earned Income Tax Credit, and also the Health and Safety for All Workers Act, the AB 1257. If people could support those legislation and call their own assembly members and representatives. So I think that would be what I.
Okay, Ian, if you could put those in the chat, the names of the legislation, so that we are aware of that and we can keep those in consciousness as well. Thank you. Okay, Joseph, one call to action.
So I believe in solution. So one thing that I would like to share is we must all know that children are the future for tomorrow. So we all look into children in order for us to accomplish whatever that we want to accomplish. So one thing that I would like to ask is the community is for us to volunteer to become mentors to those organizations that supporting this vulnerable community. In terms of money, but I would like physically become a tutor, an online tutor. It's very important because all these children, they have a big dream, and the parents have a big dream to the children, and they all want them to succeed.
Okay, and Joseph, if you can also just put that in the chat, the real need for direct support as mentors to work with the children and ways that they can contact you to be able to do that. Thank you.
Yes.
And then Arwa, one call to action.
I'm concerned a lot about the mental health of the societies. I know we're doing our best to provide food for them and health resources and so on, but the mental health. And don't wait for them to seek, for the families to seek help. I really want to find a way that we could reach out to those families and then check on them, maybe provide funds for that, look for volunteers. I'm a coach, I'm willing to volunteer for that. I just like to check on people. It's just make sure that they are not only full of stomachs, but safe and feeling okay and feeling happy at home. So it's just the mental health, I would say. Wow. Service.
Okay, then you called me to action because at the Nonprofit
Yes.
Institute At the University of San Diego, we have developed a resilience-based coaching program. And the idea of that program is to provide support, 3 sessions, absolutely free, for anyone who is experiencing stress during this difficult time, and to try to find ways to bounce back from that. And we can provide that information as well. Each week when I moderate these panels, not only do I gain an education from it, I believe we're doing a true service to the community by giving voice to corners of San Diego County that would not otherwise be heard. And I want to thank you not only for the rich information that each of you gave, but also the rich presence that you brought personally to this process. And with that, and I will turn things over to Tony Young. Thank you very much.
Thank you, Dr. Green. I want to specifically say thank you to Ian, who provided just a great part of this discussion, and for him joining the RISE family, because really there were 3 RISE fellows who were on here. Arwa, Graciela, and Joseph were all RISE fellows. So we want to say thank you to them, and it shows kind of the work that we're doing in the community. But one of the things that I thought about during this discussion, Dr. Green, was really that, the immigrant population is a vulnerable population. We know that, and we're going to advocate for that. We're going to work toward supporting them. But you know what? They are also the ones that are going to be showing us the way. And it's very clear that these 4 individuals that we heard today clearly articulated that they are working with people who are willing to do the work to help this community, this city, and this country move forward. So we appreciate that. And Dr. Green, obviously I appreciate you. What a wonderful job. And we thank you for the work that you do. A couple other things. We got a couple of upcoming programs that we want to make sure that you know that RISE is doing. We do non-profit trainings, and we do that regularly. If you get on our website, you'll find out more about it. And next week, we're going to focus on COVID-19's impact on child welfare. And obviously, that's something that everybody's concerned with. Joseph was very clear about that today. With that, we also want to say that we're going to give you a survey about this event, and you let us know kind of what you all thought about it, and also give us some insight or input. You can give us a call or get on our chat line to let us know what you think. So with that, thank you all so very much, and we will see you next week.
Thank you, Ian. Thank you, Joseph. Thank you, Arwa. That was stunningly wonderful. Graciela, you were like really here. And thank you for bringing that part.
Thank you.
Okay. Thank you, Dominic. That was seamless today. I really appreciate that as well. And, continue to do the work